I'm going to move on because the next issue is the one that I've focused on, and I think in the end is going to be the critical one. It is summarized by the comment made to the two Washington Post reporters in the Watergate scandal by their source, Deep Throat: follow the money. The money is of critical importance. The piece that is in your handout makes, I think, one central point, and that is that the ramp up for spending under all the health care reform bills is slow, but then becomes steep. That means that the great bulk of the cost of the bill, whether it's $800 billion or $1 trillion, occurs in the latter part of the 10-year accounting period that is going to be used to measure the cost of the bill under congressional rules. The simple rule of thumb is you're going to spend about 20% of the 10-year cost in the 10th year, and costs will be maintained at that level or higher in subsequent years. Now, that's of critical importance because President Obama has said throughout the year and reiterated under terms he could not conceivably, in my view, back away from during his speech, nor should he back away from, that he will not sign any health care reform bill that is not paid for over 10 years and in the 10th year. Furthermore, members of Congress have tasked the Congressional Budget Office with providing at least a rough estimate of what the costs would be beyond that 10-year period. This requirement actually, I think, had a profound effect on the way in which Senator Baucus drafted his bill. I told you you would get into budgetary weeds here, and here are a couple. The House bill actually rather bravely took on and addressed a legislative screw-up from some years back called the Sustainable Growth Rate Formula for paying physicians under Medicare. This was a proposal to place overall spending limits on how much is paid to Medicare physicians, and stipulated that if the spending targets were exceeded, then the price, the fees of physicians would be cut enough in subsequent years to bring total payments back down to the target levels. Lo and behold, the budget was exceeded. Lo and behold, Congress saw the implied fee cut and for a number of years has done exactly the same thing. They've said, we're going to stick by that law, but not next year. Next year, we will increase fees a modest amount, but we won't cut them as required under the formula. Well, right now, the backlog of required fee cuts is huge, in excess of 20% required for next year. Congress is not going to do that, but in order to correct it, you have to change the law, which the Congressional Budget Office will score as a spending increase relative to the baseline. The House bill said, okay, we're going to fix this, and we're going to try to raise money to pay for it. Actually, they didn't raise enough, according to the Congressional Budget Office's estimate. But when it came the Senate's turn, Senator Baucus's committee's turn to do this, they backed away from this issue and said, we'll fix it for next year, but not beyond that period. So they did what Congress has done in the past, and that has a very nice effect. Not only did it help the Congressional Budget Office bring in an estimate saying that the bill was paid for over 10 years by the tax increases and spending cuts contained in the bill, and in the 10th year. But in addition, although they couldn't give a hard estimate, it looked like the surpluses would widen in the period beyond the first 10 years. So there is a bit of budgetary game playing that has been played and may well be played in any reform legislation that actually gets passed. But the challenge of raising sufficient funds to pay for a bill that members of Congress are willing to sign is something that remains to be addressed. I don't know the answer to this. This is genuinely inside baseball, but I can see Arnie looking at his watch, and that suggests that it's time for me to stop.